Hi there everybody and welcome back to my channel. Today I will be talking about conjunctivitis and how it can mean more than just simply a pink or red eye. So if you want to learn more about this, then please stay tuned. In terms of conjunctivitis, if you asked most people on the street what conjunctivitis is, they will be able to tell you that conjunctivitis is when one develops pink eyes or red eyes. Commonly, it is seen in the community in the context of a bacterial infection or a highly infective viral process, which is where other members of the family and other children at school, if that's where it is initially found, can become affected with it. However, there are other types of conjunctivitis which I will briefly talk about today to try and improve one's understanding of what exists out there. Blepharo-Kerato-Conjunctivitis (BKC) is often an undiagnosed condition. Patients can present back and forth to their optometrists with irritable eyes and photophobic eyes and blurred vision, and they may indeed be told that they have blepharitis. However, the involvement of the other structures, the K and the C as I mentioned, particularly the K, the cornea, this is potentially missed or overlooked, and the patients are therefore not optimally treated, and therefore their condition seemingly may get better on a small degree. However, it does not fully resolve. The cornerstone of BKC is the blepharitis, which initially starts all of the other processes off. Now, blepharitis can be reviewed as a condition in its own right in another video that I've made, but essentially a buildup of debris and then these toxins from the bacteria that may be present getting onto the surface of the eye can cause a whole host of problems. The reason why primary prevention is crucial in BKC is because once the cornea becomes involved, the symptoms of the patient will dramatically increase. So this can be photophobia, this can be discomfort, this can be blurred vision. Now, if the cornea becomes involved and a patient gets repeated attacks, the problem with this is it can lead to scarring, and this will then have potentially long-term ramifications on how well they see. Patients whom are suspected to have BKC can usually be diagnosed from a careful history and examination. They don't really need any specialist tests. But one thing to bear in mind with these patients is the fact that in terms of the symptoms they classically present with, which is what I've already mentioned in this video, things such as tearing, photophobia, blurred vision, crustiness of the eyelid margins, a condition that seemingly improves and then comes back if treatment has been initiated. As well as all of these things, remember that patients can also have lumps that they find in their eyelids. These lumps can be tender and sore, and these lumps may clear and may come back. So recurrent eyelid lumps is also a feature of this condition. Typically both eyes are involved. The eyes will look red, the eyelid margins may look red and swollen, the vision may be poor. If it is a condition that has been there for some time, there may already be some corneal scar in there, and patients with this condition, particularly if they present acutely, are very difficult to examine because they are very photophobic, i.e. sensitive to lights. Because of the chronic nature of BKC, it is very important to explain the diagnosis very clearly to both patients and their families. This is because they will be undertaking potentially long, arduous treatment protocols, and they may need to do this several times a year, for example, if the condition comes back. So if they fully understand what it is that they are treating, then evidence shows that patients and their parents tend to engage more if they understand what the end goals of treatment are. As blepharitis is present, The initial aspects of treatment and the cornerstone of treatment center around treating the lid margins. So this involves heat therapy, this involves massage therapy, and then this involves eyelid scrubs. I've covered this in a previous video, so I'd please ask you and encourage you to watch my video on blepharitis, where I cover this in more detail. Beyond this initial treatment, the degree of involvement of the other structures of one's eye and the degree of symptoms will dictate what other treatment modalities are initiated. But speaking broadly, patients will be started on ocular lubricants, they will be started on eye drops that are antibiotics, they will be started on eye drops that are steroids, and then for more severe involvement and more severe disease, this can be escalated up to tablet antibiotics and even other types of immunosuppressive tablets to try and get on top of the processes that are taking place causing the BKC. Thank you for watching this video about BKC. I hope it's been informative and educational. If you've liked this video, then please do give it a thumbs up, like, subscribe and comment. As ever, thank you so much. Take care.